Good, yeah, good.
All right, good morning everyone and welcome to East Technical High School. This is one of the 2 vaccination centers the district is opening in partnership with the Cleveland Department of Public Health. These 2 sites will be used to vaccinate our over 7,000 employees, the substitute employees and contractors, as well as employees, substitute employees and contractors from 26 non-public and charter schools here in the city of Cleveland. We'll be open this week, Wednesday through Saturday, and we'll serve about 3,200 people. And we'll open again next week for the balance of those people, another about 3,500 people. Our community is getting the Moderna vaccine, so we'll have our first dose this week from February 10th through the 20th. And then we'll have a 4-week rest period before our second dose that will happen the week of March 10th through the 20th. Vaccinations are voluntary, these are not mandatory. However, we are working hard to educate, and thank you for being here to help us communicate the importance of the vaccine and our comfort as district leaders and union leader representatives who are here today to get their first dose vaccine. In a moment, I'll go back into the line and work through the process. We'll do a shot of just me first for you, and then we will move 9 other people through all 4 stations so that you can get a sense of how the process will work. And I'm happy to answer any questions before we begin the process.
Do you have an idea? How many per day you guys are hoping to do?
So I'm not exactly sure the number per day. I can get that information for you, but I would say we're talking probably about 600, 700 people a day to get 3,200 people through in a week.
Do you have that amount of vaccine?
The vaccine is here. We're very pleased that Governor DeWine has made K-12 a priority, and they did, once they knew we were ready to go, ship vaccine sufficient for this week. We'll obviously have to wait for next week to make sure we get sufficient vaccine for next week as well.
And just my last question, I know we talked earlier, once a certain amount get vaccinated, talk about some of the plans going forward about maybe starting back in a hybrid mode or whatever mode that might be.
All of our educators are excited to start back to school. We have been the whole time. We will continue to look at the public health data, which is improving in Cuyahoga County. That's exciting news. I also want to see how this process works this week to make sure we're on track for vaccines, and remembering that our second dose doesn't happen until mid-March. So all of those factors will be used to make a final recommendation, either late this week or early next week, about when we'll be ready to move to hybrid. Even when we move to hybrid, our families who are not comfortable coming back to school will still have a remote option as well.
Thank you.
What percentage of your staff will be receiving the vaccine?
So based on our information surveys of our faculty, we know at least 75% plan to get their vaccines from one of our 2 vaccination centers. Another about 8 or 9% have already gotten it or will receive it from another healthcare provider, and under 10% have said that they are not interested in being vaccinated at this time. So we have a pretty high response rate, but part of the reason we're doing this public event and an education campaign, including a selfie station you can see on the way out of the door, is so neighbor to neighbor, employee to employee, we continue to encourage everyone to get the vaccine.
Yeah, what message are you hoping to send by being first in line for this?
Well, I want the message today not only to be about me, but about my leaders that you will see, people of color here in the organization, as well as union leaders who are all standing with me today to say that we feel safe and comfortable, and we hope the rest of our employees do as well.
Where's the second vaccination site?
The second vaccination site is Max Hayes High School on West 65th on the Midwest side.
For that under 10% that doesn't want to be vaccinated, what adjustments are going to be made, or are there going to be adjustments for the teachers to get vaccinated?
We understand that vaccination is a very personal issue. There are long-standing negative historical consequences, particularly in the Black or African American community, and there are people who are religiously or morally opposed. So this is not a mandatory vaccine. However, when we do return to work, employees are expected to return and serve our students, whether they chose to be vaccinated or not.
Governor DeWine has set March 1st as a target date for in-person learning to resume across the state. Is that a possibility in Cleveland, or what would be the earliest you would be able to resume any sort of in-person instruction?
Well, again, I'm not going to make a decision about when we'll shift to remote until I see how this process works this week. But I would say getting our first doses of vaccine in a window of February 10th through February 20th makes March 1st a pretty tight window when we won't even have the second vaccine. But I do plan, after seeing how this process works this week, hopefully it'll work as well as we expect it to, that will give me enough information to provide a community update.
So would it be fair to say that the Cleveland schools would not resume in person until second doses are completed?
I need to see the health data and how the process works.
What's the feeling like for you? I mean, it's been a year of craziness, and finally you're here to get vaccinated. What's the feeling like? Are you excited? Are you hopeful for the future?
You know, I think this is actually one of the most nervous parts for so many of our employees. I think once we're through this first cycle and everybody finds out that it didn't go badly, everybody's fine, the second cycle will be easier. I also think there's a little bit of a dark before the dawn that we keep getting reminded. We still have to wear masks. We still have to socially distance, even with the vaccine. But I'm really excited that we're seeing our way through the pandemic. And I'm really excited about what we're going to be able to do to support kids and families into the summer and into next year as we recover from the pandemic.
I know that there's been data from your district and other urban districts showing that students that have not been in class have been falling behind in some respects. How important is this vaccination process to getting kids back in class and resuming more of a traditional learning system?
Well, I think the vaccines are critical. I mean, we've seen the very public fights that have happened in districts all across the country. You have not seen that here in Cleveland. We've worked very closely with our labor partners. But employees need to be assured that they can feel safe and confident to work closely with kids who need them. And so the vaccines are critically important. As far as the lost learning time, what we do in response as we move into summer and as we move into next year is going to be every bit as critical as the efforts we've made throughout the process. And having a safe workforce is a key to being able to run all those extra programs.
Obviously, a key component to this is funding, and there have been a lot of changes early in the year. There could be a lot of changes by the time CMSU is projected to return to building. How confident do you feel in funding arriving to help pay for some of these precautions that you've taken?
Well, fortunately, as you know, we all received the CARES Act dollars early on from the administration. We used those to outfit our buildings, to buy PPE, to buy the remote tools. And in December, we saw the second stimulus fund that is giving us additional funding that we will likely need to rely heavily on for summer programming and next school year programming. And we know that the Biden administration is forecasting additional funding. The worry for us as a community is less a near term because there's immediate funding available. But if we look back to the last recession, the recession ended in 2010. The district actually saw its worst financial picture from 2012 through 2015 because public agencies tend to lag behind. So what the administration does to protect us long term is going to be every bit as important as what the administrations have already done in the short term. Okay, folks, I'm going to step away so that we can move through the line. Again, I'll be the first one back so that you get just a shot of me. And then I hope you'll be able to get a broader shot of all 4 stations running with our community leaders of color and with our union leaders so that my employees get to see everybody here in support of them. Thanks for being with us today. I'll be right back.
Time?
I guess so.
Hey, so are you gonna be standing up or are you gonna sit next to him? Are you just gonna walk up next to him and?
I think I'm standing.
Okay. So, is he gonna get it in this arm or the other arm? If he's sitting in his chair, what are you doing? As far as does it matter what arm he gets in if he's sitting in the chair?
Left
So
arm.
I'm trying to think visually. I'm trying to think. So I guess we slide the chair out maybe. I guess we slide the chair out a little bit this way maybe, and then so you're just gonna come in there and.
Well,
I was just trying to visually think.
yeah, for sure.
Okay,
Yeah,
perfect.
yeah.
Okay, awesome. So that's why they
You have larger books. I was sprayed. Oh yeah, different chairs. You know, left or right. Which way? Yeah, because I could have my back. Whichever, it doesn't matter. Whichever.
I got you. It's all good. It's all good. I'm just gonna stand next to the camera.
Well, they're still drawing the medication. Up,
Okay.
So as soon as that's together, we'll get started.
Okay. Oh, here's this.
And you're positive was beyond 14 days.
Yes,
correct?
it was back in July or August.
Okay. All right, I'll be right with you.
Okay.
Left arm, just so we're clear. Okay.
Dress him up a little bit. Makeup.
I'm gonna take this off. You don't need it anymore. And then you're getting in the left arm, right?
Yes.
Yes. Eric, go ahead and fill out first name, last name, date of birth, and then the nurses will take that and fill in your lot number and all
Okay.
that stuff.
Thank you.
We'll see who's gonna sit first. I mean, I want to hear him yell and scream. Eric, just slide it maybe a little bit forward. Whatever. Yeah, somewhere to get a little bit. Perfect. Thank you.
As soon as you're done drawing the medicine up, we'll get started.
Okay.
Does anybody need small blood? And you never had an anaphylactic reaction to anything like that?
Nope.
Okay.
How long have you been with us?
I've worked both as a sub and a school nurse, so I've been a substitute teacher since like 2006.
Okay.
And I started as a school nurse like 2016 or 17.
Great. Great. And your name's Kevin, right?
Chris.
Chris. I'm sorry. I'm
Yeah.
terrible with names.
That's all right. I mean, in the roster, you'll probably see me as Robert Head. but
Okay.
I go by my middle name.
Okay. So when you do this, you'll need to step here so I can look that way for them.
Yes,
I
yes.
know normally you would probably keep a different distance, but
Right, right.
for their point of view.
Yeah, yeah. Just line you up and go right in this shoulder.
Sounds good.
Yes, sir. And then afterwards, since you haven't had a reaction, there'll be a recovery area for like 15 minutes.
Yep.
So yeah, go over there. I will.
So remember to swirl the syringe prior to injection. You need help with anything?
Should be okay. Thank you very much.
All right, folks, that's it. Vaccinations have begun for Cleveland Public Schools educators. We'll have another group of people come through in just a moment.
When he can leave.
He can leave. So that's pretty much now. 9:22.
No.
Oh,
What
this-
time he can leave. So 15 minutes for that. Yeah.
Okay, so that's
47. 37, I'm sorry. Observation station. Also, you did not put the time that he has to leave.
yes. I
Did
gave
you
to
put it on?
Katrina. I gave it to Katrina.
So
Should
that
that be?
should go with.
Should that be on here? What are these?
Okay.
Is that what this
Do
is?
not use these. These
Don't.
are not. Yeah, I'm writing by hand. These are not.
Okay.
These aren't accurate.
Okay.
I'm gonna write lot number for you.
Thank you. You got another one? Ready for another one?
Yeah.
Okay.
Ready?
Do you guys have vaccines here?
I have 2 doses.
All right, do you have vaccines here? All right. Excellent. Make sure you put on the times that they have to come out of observation, okay? 15 minutes from now.
Awesome. Did you want to have anything?
Don't forget the time of return out of the observation.
Sure.
Patty, they're going to ask her some questions while she's
Sure, absolutely.
And when they say swirl, it's just a simple.
Christine Fowler-Mack.
I mean, that's all I did.
CHRISTINEFOWLER-MACK. I am. I'm the Chief Strategy Officer for the district.
The lot number.
Yep.
I wanted to get the vaccine today actually as an example for our educators that we believe
Yeah, we're good to go.
this to be a good choice
And
if
I'll
it
put the
fits
time
with
out.
what our educators want. And we want to be ready to serve our children.
How do you feel about being one of the first to get it?
I do.
I believe in the science, so I too have watched the debates, I've watched the science unfold, I've watched
you'll have
Dr.
15
Fauci,
minutes
and I believe in the science.
Ma'am, can you stay? Can I get a couple quick? Can I get a couple questions from you? Senator?
yes.
What's your title here? I'll get it on camera.
Okay.
You're gonna grab more gloves. I'm so sorry.
Oh, sure. We have a whole box